Alright, so basically then, this layer, which is the cornea, when you pass the when you go laterally from the cornea, then you're going to get into a border where the cornea changes color, and it is going to appear white. All right. So centrally we have the cornea, which is transparent. So as you look at your neighbor, you can see through the cornea, right? And what you are seeing behind the cornea is a coloring, and that thing that has that nice color, that's the iris. And it's when you talk about something that is iridescent, we're talking rainbow, we're talking about different colors. So the iris gives impart that color to the area behind the cornea. But as you stay on the cornea and you go laterally, you go away, then you're going to get into a little groove and into a border, which is referred to as the limbus. And beyond the limbus, we have the sclera, which is white. And that is a tough, hard coat of the eye. The junction between the limbus, the junction between the cornea and the sclera, what we call that? The cornea-scleral junction. But what is the other name for that? What's the other name for the cornea-scleral junction? The limbus. What limbus mean? Limbic. Look at it. You're just doing neuro. And you had limbic lobe. What limbic mean? No. It deals with emotion, but it doesn't mean emotion. Emotions. Limbic means border. Border. Yes. Border. It's a border. Yes. That lobe is a border. Taking the medial side and it's going to go right down onto the temporal lobe. It's a border. So we have here at the junction of the cornea and the sclera another border. And that border is the limbus. Now a lot of activity goes on in the limbus. The limbus centripetal forces tend to move the cells from the limbus to the center, so that one side can be producing clear cells and the other side is producing sclera, which is white. One part is transparent and the other part is opaque. So that junction is a very important junction, the limbus. The radius of curvature of the corneal section is different from the radius of curvature of the scleral section. The radius of curvature of the cornea is smaller than the radius of curvature of the sclera. So you have, as it were, a blowout on the back. You with me? So you have a small cone at the front and then a bigger cone at the back. So like the anterior 1/6 is going to describe a smaller radius of curvature than the posterior 5/6. Yeah. What's the volume of the eye? Volume of the globe, 30 cc's. 30 cc's. All right. Now, when you go through the when you go through the sclera, then you are going to come into an area which is part of the vascular layer of the let me see if I find a little globe that shows the All right, I just use this as an example. So let us say we were cutting the eye across. What we will find is that on the inside, we'll have what represents the retina, and then we'll have a dark area which is outside of the retina. That is going to be the choroidal layer. And outside of the choroidal layer, we're going to have the top scleral layer. Okay? So see that in mind. Top scleral layer on the outside. Internal to that is the choroid. And the word choroid means membrane. And sometimes you might come across the term uvea. Uvea means grape. Grapes are usually dark in color. Uvea is referring to this dark layer, which is internal to the sclera and external to the retina. Okay? So you will see the term uveal tract. You see the uveal tract, then you're talking about which layer of the eye? The middle layer, the choroidal layer. You get it? Alright, so whether we're looking at front to back, that pattern is going to be there. You're looking at the cornea, deep to the cornea, then you're going to find your choroidal layer. Okay? And that choroidal layer is going to be represented at the front by something looking dark, which is the iris. And then back behind that, you're going to have the ciliary body. So let me just see if this has a picture to help you. Right, so like here, we're going to have a cornea, okay? Behind the cornea, we're going to come into an anterior chamber. And on the side of that anterior chamber, we're going to have the iris. Now, this thing is pretty damaged behind here, but you see what is left of it. The iris at the base of the iris is going to be a ciliary body. And that ciliary body is going to project some zonules, some fibers, which will help you hold the lens in place, and it will also have an iris on it. I'm going to put on one that is a kind of a junction that helps to show what we are talking about. Alright, so this part here, which is the dark front part, is going to represent what? What will this be? Cornea, sclera, okay? Cornea, sclera. Anyone, it doesn't really matter right here. But behind that, you're going to get this dark layer. This dark layer is your vascular layer. And the vascular layer is going to have an iris. Okay, this is just a piece of that has been cut. Let me see if I find a whole one. Here though. Alright. Now, yeah. Now, Doc is going to make sure you're not confused. Eh? So, look here. This top layer in front here is the cornea. Corneal stuff. This is cornea. Now, if you go back, and you follow the white, then you're going to get into the sclera. But internal to the sclera is this vascular layer, which is going to be a choroid. Okay, when we go forward, you see this choroid is going to end. It is at the back, and it comes forward to the front, but it ends at the ora serrata. And as you move forward from that, then you're getting into this area here, which is going to have this ciliary muscle inside it. This part is a kind of a base ciliary body. Inside there is some muscle. We're going to come back there. And then from that now, you're going to have the iris moving forward. So this part that I have here is the iris, okay? And the iris helps in, the iris helps in monitoring how much light comes in. We'll look a little bit at that. Now, look here. Look here. Look at the base here. Okay? You see some little things coming off here? Like the word tongue. Are you with me? Good. What do you think might have been there? You see some little strings like? Dark strings like coming off here? What do you think would have been here? Some what? Some, say something, no man, you just keep quiet. What do you need to be in front of the iris or beside the iris? Somewhere in the vicinity. You know light is going back from front to back, eh? Good. The light is passing through the cornea. After it passes through the cornea, where you want to get the light into? In the lens. Good. You want the lens. But then you want to monitor how much light it goes through the lens. In other words, suppose you're out in the bright light. You want to kind of monitor how much comes down. So that stuff that is going to come into monitor, that's your iris. So that's the black stuff. That's this thing here. This little thing here. That's the iris. Okay? Now the iris, the base of the iris is going to be the ciliary body. And in that ciliary body, you have some fibers that have to hold up. What do you think they're going to hold up? The lens. Yes. Boy, you missed something with my cutting through the thing and seeing exactly what we're talking about. But it is going to, so there are going to be some zonular fibers right here. Some zonular fibers in this area here. And these zonular fibers will suspend the lens. So the lens has fluid in front and fluid behind. Alright? Okay, now let us take a closer look at this iris. Let's put it on the high power. Anything you recognize inside the iris? What that space is? Good thing you said that, but it is not. No, it's good he said it, because if he didn't say it, how would I know that he would have written that on the paper? And I want you to write the right thing. So give me a guess. What do you think that thing is? Pupil. No, not the pupil. The pupil is at the end. Look, you see this space, you see this gap here? Gap is here? This is going to be pupil. This space between this lens, between this iris and the other iris. That is going to be pupil. So what do you think this thing is? That thing is a space for a vessel. The iris and the choroid is a vascular zone. Blood vessels are inside here. Listen to me. Gram for gram, gram for gram. The iris, the whole vascular zone, the choroid, has a higher blood flow than the kidney. Gram for gram, the blood flow in the choroid is higher than that in the kidney. So no joke business here. And some of these vessels are going to come off, and they are going to be ending in some veins that are going to be external to the globe. Okay? vertical veins. Yeah. Now, let's blow up. Let me make this thing a little bigger so we can see what the edge of this iris looks like. Look at the iris. You see how it looks? It's rough. Rough. Very rough surface. Why do you think it needs to be so rough? Bounce back on light. You want to make sure that light only comes through the pupil. So when it hits the curtain on the side, man, that's not going anywhere. And that rough zone that you see the pointer is on there, that has a lot of melanocytes and fibrocytes inside it. Melanocytes and fibrocytes. That is what that is made of. Melanocytes and fibrocytes. Fibroblasts. And look at it, the back section, the posterior section of the iris. You notice how black it looks? Very dark. If we put this on the high power, we still can't see the nucleus. The highest power you put this under, you can't find the nucleus and you can't see the cytoplasm because there is so much dark pigment inside the iris. Making sure that there is no space for any light to pass through. Otherwise, you see, for precision, you need to have the periphery dark so that light is coming in and can be processed and put on the fovea centralis. So that's the reason why you find outside on this iris is looking so rough, and the back of it is well rich with pigment. Let's look at the tip of it. Look at the tip of it. Look at the tip of it. What do you think this reddish stuff is inside there? I don't have a higher power. But why do you think that reddish stuff you see in there? What do you think that is? The sphincter. The sphincter. And that thing is a circular muscle. It is circular. Circular. So when the light is coming through, all of them can just come together like a mouth and just close the orifice so that the pupil can be made smaller. So it's the sphincter pupillae. And that is going to be activated by your oculomotor from your EDW nucleus, right? So that is going to be the sphincter pupillae. So your oculomotor going to control the tip, control the end of that iris so that you can shut the amount of shutdown or relax and monitor how much light is coming in through the iris. The aperture, the opening, the aperture, yeah. Look at the base. Look at the base now. So we at the tip here. So we have which muscle is this? Sphincter pupillae. And as I said, we are up at very high power. And we can't really see the nature of the cytoplasm inside this thing here. I have, you use higher power than what you have here, and you still can't see anything inside here. But because of the amount of melanin that is in the cytoplasm. Look down at the base now. So you see a nice big vessel? Nice big vessel. And the vessels are inside here. The whole thing is pretty vascular. You see a couple more down here? Vessels, yeah. Sorry. Not a big one. Okay. Now I wanted to show you the muscles now in the base, which is really the see these down here? The reddish ones, those are the yes, sorry, thank you. Right. These out here, these are grounded on the sclera. these muscles, that these red strands you see here, they are grounded on the sclera. So when this sclera, when they pull on the whole, the base is on the sclera, when they contract, what they do, they pull the iris out. And those are innervated by the sympathetics. So when the sympathetics light them up, they can open up, contract, and so make the opening wider. You get me? So these are going to be your sphincter, not sphincter, your dilators on the base, and your sphincters are on the tip of the iris. Sphincters will be controlled by 3, and your base muscles. This is where you have your ciliary body muscles. These are going to control the amount of dilatation that you get for between the iris. So they will help to shorten the iris then and increase the amount of light that is coming inside. Okay. Now, something else I need to mention is that in the angle here, if you look here, why is right there? Sorry that the tip of the arm thing is not as sharp as I would like it, but there is something there. What you make it out to be?
Canal of shell.
Good. Canal right in the corner there. That's the canal of shell. And remember that is we are looking at a flat, but remember the whole thing is a circle. So you're going to have a ring of veins going right around, and that is going to help to drain out stuff in your anterior chamber. The canal of shell. So look, cornea is in front. Behind here is iris. So it's a corneo-scleral junction. And in the middle there, you have these vessels. Iridio-corneo-scleral junction. Full name. Iridio-corneo-scleral junction.
I simply scleral junction, iridio-cornea junction. Or we can put all 3 junctions.
Right.
You must have iris in it.
Yes. Iridio-corneo-scleral junction. Full mass. And you see the muscles beside. They are unmistakable. You can't miss them. The nerve supply to those muscles which? What's the nerve supply? To those muscles right on the base there. Beside, just anterior to the corneoscleral junction. What's the nerve supply? Get better than that. Give me the real chemistry stuff that is getting in there. What nerves are they? You see, long ciliary can be a cop out. Sympathetic fibers from the superior cervical ganglion. Sympathetic. Right. So they'll cause those muscles to shorten, and because the muscles are grounded on the sclera, when they contract, what they'll do, pull the iris backward and open up the space for more light. So if you enter a dark room, that is what is going to happen. Or if you're frightened, your eyes open wide from the sympathetics.
Where are the pre-ganglionic cell bodies for those fibers? T1 what?
Lateral horn. Lateral horn of T1.
T1 what? T1 vertebra, T1 down, T1 spinal segment. Yeah, pre-ganglionic cell bodies.
That's in the lateral horn of
Lateral horn of the First, thoracic spinal segment. No shortcuts.
You got that? Doc was asking where are the cell bodies, where the preganglionic fibers coming from. You heard it? Lateral horn of T1 spinal segment. Good. Any questions? Suppose I had a block in the angle right there, where the arrow is. What will happen? Glaucoma, right? So we sometimes talk about a closed angle glaucoma and open angle glaucoma. So there are some patients who have their angles open and yet they have glaucoma, and there are some who have their angles too narrow, so the fluid cannot get into the veins, and they have what is referred to as a closed angle glaucoma. All right? One drug can be used to help these patients. Canasol, phenytoin? I don't think so. Maybe it can, but I don't know of that. Phenytoin, how does that work? Yes. But how does it work? No, you need to tell me. If you give me the drug, you have to say how it works. You can't just say something and cop out. Tell me something else you can use. What is it that helps in forming the fluid? What is it that is used to form the fluid? Whenever you think about a drug, don't just think of a name of something, boy. Just get that out of your head. If you can't tell me how the thing is working, don't give it. Because the moment you give a thing, the examiner going to ask, how does it work? And you're not any nurse. So don't talk about something and you don't know how it works. Yeah. Because the nurse going to say that is what the doctor used. But you are the doctor, so you can't give me nurse answer. You have to tell me what the thing is doing. Yeah. Now, one of the ways in which fluid is formed is through the use of carbonic anhydrase. Carbonic anhydrase is used in helping to form the fluid in the anterior chamber. So one of the ways that you can work against this thing is to use a carbonic anhydrase inhibitor. And that is going to block the formation of the fluid and help in keeping the pressure down. Okay? All right. Diamox is one of the Diamox, yeah. Acetazolamide. Yes, that's the drug that is used to do that. All right. If you use Canasol, then what you have to be working on is the smooth muscle component to try and make the angle narrower. So you can't use something if you want to open up the angle. So if you can make the muscle more elongated, or you can affect the smooth muscle in the area, then you can influence the angle in the corner. Okay? And Canasol will work through the smooth muscle effect. Yeah. All right. Let's look at the retina. I think that's what we have left for the eye. So let us look at that.
No, no, you hit talaga.